think one of the things that we're seeing play out in real time is how important or how impactful policy changes can be. It really took a major overhaul of several of the initiatives we pointed out surrounding payment and reimbursement for teledermatology to really create this groundswell uptake of teledermatology and telemedicine in general during the COVID pandemic to allow physicians sort of the um, ability to step out of their comfort zone and really adapt in real time to a new technology, a new platform, a new way of delivering care. And so I think that goes to show what a tremendous impact policy efforts and policy making have on the practice of medicine. And I think if a lesson can be taken away from that is for all of us as physicians and dermatologists in particular to be aware of what are we advocating for and what are the things that really matter to help us affect change that allows us to take better care of our patients. I think there are some very tangible things that do need to happen, though, to overcome some of these barriers that otherwise might be insurmountable, such as thinking about how can we get creative public-private partnerships to undertake some of these challenges of bringing high-speed internet across the country. That's not a problem that every physician, even working together, could solve. We really need to think about what are ways that either government agencies or private organizations or technology companies are going to help us overcome certain obstacles that prevent us from delivering care right now and in the future that really would impact our patients. I think a second opportunity is really looking beyond the walls of our clinic or our office or our hospital or whatever setting we're in and thinking about engaging communities in providing healthcare. This goes back to overcoming disparities and overcoming barriers. A lot of the most effective interventions have been things that are organic or evolving from within the communities that are being served in order to facilitate buy-in from patients and in order to provide a level of engagement between physicians and the communities that they work with in order to provide better care. And so I think it's really important for us as dermatology to think about that and what are some of the models that we can be adopting, learning from best practices of engaging our patients, engaging our communities in order to together work to overcome some of the barriers to providing teledermatologic care to underserved communities. It's important for dermatologists to remember that no one dermatologist is in this challenge alone or is facing this challenge alone. We are all in it together, and really we are in it together with every other physician, every other specialist, every other healthcare provider that's out there that's trying to meet the challenge of taking care of our patients during challenging times. In the end of this whole process, what is it that matters? Or, what is it that we take away? I think we as dermatologists have to always stand by this idea that we're providing high quality, patient centered, evidence based care for everyone that we're taking care of. And if you build it, they will come. If we provide those kinds of services through whatever medium it is, in person, virtual visits, teledermatology, store and forward photo review, if we keep that fundamental principle of we're providing the highest quality patient centered care and we're following evidence based practices and we're doing what's right for our patients, I think that's kind of the most fundamental building block of solving this problem or solving this challenge.